Welcome to the Economics of Healthcare by Alicia Richter. What is the economics of healthcare? According to Wikipedia, health economics is a branch of economics concerned with issues related to efficiency, effectiveness, value, and behavior in the production and consumption of health and healthcare. In broad terms, health economists study the functioning of healthcare systems and health affecting behaviors. The topics I chose are based around my family, my life experiences, and what I hope for the future of my children. My family is the most important part of my life, and their health is my top priority. I have seen my father struggle alongside doctors and hospitals to find procedures for various issues that would work with his insurance, in the end causing more issues because it was not what he really needed. If he had a health insurance plan that fit his needs better, I believe he would have received better care. I have worked through health crises with friends that would be able to be better managed through an HSA, and I have prayed with my dying grandmother in a facility that was subpar because otherwise she would have been left alone in a room because of the lack of staffing. These things are not okay. I feel that we need to take more action in our healthcare system by letting people purchase health insurance out of state, encourage HSAs, and put a bigger emphasis on the supply side of healthcare. Having the ability to purchase healthcare out of state would give the consumer a chance to purchase a plan that is more consistent with their personal needs. God did not make us all identical for a reason, and we need to be able to embrace our individualism, and that includes our needs for healthcare. A generalized one-size-fits-all healthcare plan will not work for everyone. The health insurance plan that I have for my 3 children, husband, and myself would not work for my 72-year-old mother who is healthy but has different health needs, or my 75-year-old father who is not in good health and needs more consistent care. Having the ability for cross-border purchasing would make the insurance industry more competitive and have expanded options. Some states started to allow out-of-state health policies starting in 2008. Rhode Island was the first state that passed a purchasing law to create a regional health care insurance compact. Wyoming was the first state in 2010 to sign a law that included a multi-state compact that was related to the federal health reform. Other states include Georgia, Kentucky, Maine, and Oklahoma. Washington had a study order adopted, but no further action was taken. Arizona passed a bill in the House and Senate, but was vetoed by the governor, so it did not become a law. If the government provides or forces insurers to provide insurance to individuals with pre-existing adverse health conditions, how will this influence the incentive to purchase insurance when one is healthy? I believe that everyone does need health insurance, and we never know when something will happen. With the option of out-of-state healthcare policies, the purchase of insurance when one is healthy would be more accepted, as it could be a more personalized plan. Right now, we are forced to purchase insurance in the state we live in, whether we are healthy or not, and that encourages people to not purchase health insurance when they are healthy because there is not a plan that fits them. The second topic is about encouraging health savings accounts and the direct payment of medical bills from those accounts. So what are health savings accounts? Health savings accounts, or HSAs, are a unique tax-advantaged account that can be used to pay for current or future healthcare expenses. When combined with a high deductible health plan, it offers savings and tax advantages that a traditional health plan can't duplicate. HSAs can be used to pay for eligible medical expenses, deductibles, co-insurance, prescriptions, vision expenses, and dental care. You do not lose your funds if you do not use them, all in the current plan year, as you can roll them over from year to year. And after age 65, funds can be withdrawn for any purpose without penalty. HSAs definitely have their advantages, including the number of expenses that do qualify are more than most people think. God wants us to enjoy the kingdom He gave us, and that includes the time we spend with our families. If we have to spend more time on figuring out medical bills, it takes away from our family time. Most HSA issues a debit card so you can pay for prescriptions and other expenses right away, so you don't have to wait for a bill to come in the mail. If the government provides or forces insurers to provide insurance to individuals with pre-existing adverse health conditions, how will this influence the incentive to purchase insurance when one is healthy? I think that HSAs are great, but I know that my family currently does not take advantage of it because of how sick our youngest son was, and we needed to utilize a lower deductible, high premium plan because that fit better in the way we run our finances. If the government forces insurers to provide insurance that I think there should be the option of an HSA or a lower deductible plan. HSAs do have many advantages, but there are also some disadvantages as well, such as the high deductible requirement, the pressure to save, taxes and penalties if you withdraw funds for non-medical needs, record keeping, and fees. HSAs are better for those who are healthy, so this would give more incentive to purchasing a healthy plan when healthy. The third topic is placing more emphasis on the supply side of the healthcare market. The government spends billions of dollars each year subsidizing demand and helping people purchase healthcare, but they do not spend much on increasing supply. Without additional supply, subsidies just lead to higher prices. Many countries will spend more than 20% of their GDP on healthcare by 2050. Two of the biggest reasons for the increase in demand is the prevalence of preventable illness and the suboptimal use of healthcare resources. Let's take a look at obesity. It is preventable, yet some people do not take the appropriate control of their health and seek help to find motivation to create a healthier lifestyle. The lack of initiative to live a healthy lifestyle has led to the misuse of the healthcare system. The only people who benefit from the subsidies are the healthcare providers, as they can raise costs for their services. Supply side would focus more on training of healthcare providers. It was quite shocking to read that only 2 new medical schools have been established in the last quarter century. A very personal story for you is about my son Andrew. He was susceptible to croup for the first few years, and on one of our many hospital visits, the doctor decided that he should be admitted because of how long it was taking him to regain his breathing and the amount of steroids needed to open his airway. We waited in the ER for hours before we were told that they had a room for him, but there was not enough staff on the floor that he would be moved to, so we'd have to wait it out. It was midnight and he was 2 years old. It was time to get this boy some rest. My husband and I had to make the hard decision of waiting it out and hope we'd get into a room, or go home and hope that his croup subsides and we don't have to come back. We chose to go home as it was in the best interest of our child. The doctor was extremely frustrated about the lack of staffing and understood our decision. This situation has been ingrained in my mind and a true issue of the supply of healthcare professionals. If the government provides or forces insurers to provide insurance to individuals with pre-existing adverse health conditions, how will this influence the incentive to purchase insurance when one is healthy? I think if we can put more emphasis on the supply of healthcare, more people that are healthy would purchase insurance, as it would be easier to make well-check appointments or yearly physicals because of the increase in facilities and/or physicians. The 3 topics I chose to show you have affected my family and my own healthcare. If we were able to purchase a healthcare insurance out of state, we would be able to get a more personalized plan and not a one-size-fits-all plan they were all forced to utilize. HSAs can be great because of the tax advantages and the ease of medical payments, but they are also hard to manage due to the stress of saving the money and not using it so you can take it out at retirement. Lastly, the emphasis on the supply of healthcare. This is the biggest issue I have with our healthcare system, as I have seen firsthand how this can affect a child, my child. God has given us the tools we need to succeed in life, and we need to learn how we can sharpen those tools so we can build a better healthcare system for all. Thank you for taking the time to learn about these 3 topics, and additional references are listed.